can have the, yes, here. So this patient is very young. She has a good skin elasticity. She has, as you can see, the dark circle. It's a genetic issue. I don't have any treatment for that. And she had a depression, as you can see on the 3/4. So if we go back to the patient that is just with me, you can see here the dark color of the skin here with the depression on this area and the palpable malar groove that is on the lateral side. If I show you where are the dangers in this area, if I draw, for example, where is the angular artery? So the angular artery, you remember, is the terminal branch of my fascial artery. So if I turn a little bit like this, and if we zoom a little bit on this area, you will see that my fascial artery will be here. So it means in the nasojugal groove, and then we'll go on the side of the nose. You can see sometimes the angular artery beating here. So it's far away from my tear trough. And you will have in the mid-pupillary line just 3 millimeters, and you can palpate a little here depression. This is where you have the infraorbital foramen. So you see that this infraorbital foramen is far away from my tear trough. So these two dangers are not a danger for the tear trough. I will use a cannula to this patient, but I can use also, if I want, microbolus of redensity 2 with a needle. And also the same for here, where you have to correct a little bit, you know, the palpable malar groove. Patient assessment. Patients that are contraindications are patients with a swelling, what we call the malar mons here, will be a contraindication for me. Patients with a positive snap test. What is a snap test? Is you pinch here your eyelid, you pull out of the globe like I do, and you relax. And you see how long it takes for the eyelid to go back to the globe. If it is more than 3 seconds, your snap test is positive. Look, I pull, I relax, and here it's less than 1 second. So she has a very nice, you know, skin elasticity. So here I will do where a drawing always. I do always a drawing, and I will do a drawing where I will put the product. So this is my depression, and I do a line here. Okay, this is my line of depression I will correct. And I have the line of the palpable malar groove. And at the cross, this will be my entry point. So I will put my gloves, and I will show you how I do. But I will give you some tips and tricks. First, when you do your injection, and you start and you begin to do such injection, I do this injection in a sitting position. Why I do in a sitting position? I will do the disinfection. Close your eyes. Thank you. Why I do that, you know, in a sitting position? Because if you do in a lying position, if you do your injection in a lying position, your patient will have this fat here. If we can zoom on the patient and not on me. If you are looking here, the fat, when she is lying, covers the depression. So if I do my injection And if I am a little bit anxious, I will put my cannula superficially, and my product will not be in the tear trough location, but will be in the superficial fat. So this is why when I teach, to do a tear trough injection, I always ask the beginners to do their injection in a sitting position. Like this, if they are too superficial, then the product will remain at the same place. If they do in a lying position, the product could move downwards and create like a swelling. So here, my patient is in a sitting position, and I get the product, Redon CT2, with a cannula, and you have to calculate the length of the cannula to reach the top of the tear trough, because sometimes I see some beginners who use a cannula with not the right length, and so they can't achieve the depression, to feel the depression here at the top, because the cannula is not long enough, and this depression at the top is the depression that is the depression that is the darker one. So this is why I want to go there. So look, I use this little trick. I always have all my cannula and needle in one hand, and I will use my cannula on the other hand. So I will turn a little bit like this. I will go with my needle just here and straight to the bone, because you want your cannula to go deep on the bone. Then this needle will give me also the direction. So as you can see here, my needle will give me the depth and the direction. Then I will introduce my cannula, and for that I will use my 25 gauge cannula deep on the bone, and then I will follow the path of this area. So here you see I'm introducing my cannula, go deep on the bone here, and sliding slowly on the bone, and I'm going to follow the direction of my tear trough. So here I'm deep on the bone and going slowly. Est-ce que vous avez mal? And I can do an anterograde or retrograde injection. So I can go forward, going up and then inject, or if you encounter any resistance when you go in the tear trough, you can inject a small bolus of product here, and this will help you to go forward. So here I'm very deep, you don't see my cannula, and I will inject slowly tiny amount of products here, and I will go up until I reach the darker area. I don't do any massage, and I will inject slowly my products just to erase, as you can see here, my depression. I put 0.3 ml of product in this depression, and I will just mold a little bit. So if I show you what I did, I will show you in a sitting position, but first I will do the palpable malar groove, and I will sit my patient. So to do the palpable malar groove, I will need to go just on the other axis to turn my cannula, stay deep like this, and go on the other side. So I will go on the other side of my patient. I turn around. I ask my patient to turn the head a little bit to me. and I will go on the lateral side. So for that, I'm deep, I'm going here, and I will feel a little resistance here because you know that I will have to go up along the palpebral malar groove. And I will inject slowly, little amount of products, and normally I put an average of 0.2 ml of products in this area. That's all, it's finished. I put 0.3 in the tear trough and 0.2 in the palpebral malar groove. And I will show you the difference if we can put the head and zoom on one side here, as you can see, and the other side with the depression that disappear in this area. And I will do the other side of the patient just to show you that with the rest of my syringe, I have still 0.5. I will do the other side. So here, I do my entrance point. You remember, straight to the bone, deep on the bone, giving the direction, as you can see here. I will introduce my cannula. So you see there is no blood here. And I will introduce my cannula in the little hole, follow the path, and you see there is no resistance. It's sliding on the bone. And I will inject on this side, not with an anterograde, but to show you another technique, with a retrograde injection. And I will inject 0.3 ml of products here, going slowly, injecting slowly, and I prefer to not to overcorrect. It means I prefer to put less than too much. And I will put an average of 0.3 ml of products in this area. I finish my 0.3. I do a little, as you can see, massage of this area. It's not a massage, it's a molding of the product. And then I keep only, as you can see, 0.2 ml of products. And I will go in the palpebral malar groove. So you see I turn around and I'm going in the palpebral malar groove, deep on the bone. So I turn around my patient again because it's not the same axis. I turn the head of my patient a little bit and I'm going up just in the palpebral malar groove. I'm just here at the top and I'm going to inject slowly 0.2 ml of products to limit the depression in this area. So I put 0.2 and I will do a little massage at the end. So I use one syringe of redensity 2 with a cannula, and now I will use the post-procedure cream just to avoid the bruising, just to avoid the swelling and hematoma, and I will do this with my patient just to have a smooth, area with no bump. I will show you when I will finish. I will put this patient in a sitting position and I will show you the outcome at the end. Do you have any question? It's a classical injection to do that. It's a classical injection, and so I think a lot of you are doing the same than me. Some use a needle, but never for a Caucasian lady use a superficial injection. Remember that redensity 2 is a product with the IFU, it means the recommendation. It's a product that you need to use deep and not superficial. Even if I know that some of my colleagues in Asia use superficial injection. So here, I finish with the massage, and I will put my patient in a sitting position. Est-ce que vous pouvez vous asseoir? May we zoom on the patient? So you see here, the color is still there, but the depression disappears. Not all the depression, but you see also here, the lateral part disappear. So it's smoother. The color is less dark in this area. You see that you don't change the color of the skin, but because you change the depression, you change also a little bit the color. So she looked younger, she looked fresher, and she looked less tired because the lower, the infraorbital hollow gives the tiring aspect for our patients. Do you have any questions?
So actually, we don't have any question, Dr. Trevidic. Thank you for this very nice presentation. I think it was very clear for our doctors today. Please don't hesitate to ask questions to Dr. Trevidic. We still have time to answer. So just send us the question.
Ça vous plaît? Je vais juste peut-être en rajouter un tout petit peu, vous voyez ici, un tout petit peu, parce qu'il en manque un tout petit peu.
Maybe, Dr. Trevidic, we've got a question just before. It was during your presentation. Using a small gauge needle can affect the properties of hyaluronic acid gel?
You have with Redensity 2 a 30 gauge needle in the blister. And normally what are the recommendation of the company is to inject with the needle you have in the blister. So it means that if you use a smaller needle to inject Redensity 2, we didn't analyze the product that you get at the end of the needle that you will inject. So perhaps because you use a thinner needle, perhaps the product in the syringe will not be the same than the one you have at the tip of the needle. So my recommendation will not be to use a smaller gauge needle to do your injection. Use the needle you get in the blister because this is the needle where we perform all the tests, the clinical study are done with this kind of needle, not a smaller one. So this is my advice and the advice of the company.
Thank you for your answer. We don't have any more questions. So,
Okay.
So we will, oh, I'm sorry, just get, how to treat the overcorrection of tear trough?
Unfortunately, because the tear trough injection lasts a long time, longer than the lips, longer than the cheekbone. If you get an overcorrection or a malposition of the product, you will keep it during a long time. It means more than 1 year, more than 2 years. So my recommendation in this area, specific area, is not to wait. If you wait, your patient will knock at your door of your office every week during years and years. So my advice is to use immediately when you see again your patient at 3 weeks, if you do like me, to do a little bit of hyaluronidase to erase the product. And if you have a swelling in the lower orbit after an injection, do also a little injection of hyaluronidase. This is the only way to correct, you know, this overcorrection.
Okay. Thank you, Dr. Trevidic. we've got another one. Can we combine redensity 2 deep with redensity 1 superficially?
Redensity 1 is a non-crosslink HA, and so because it's a non-crosslink HA, it has an action on the skin quality if you inject very superficially. So why not? It's a good idea to inject redensity 1 superficially, but be very careful because the skin of the eyelid is very thin, not to get bumps, because it's what you want to avoid. And for me, I got in redensity 2 products that have an action on the skin. And even if you put this product deep, the product will migrate a little bit superficially through the muscle, and so will have an action on the skin. So I must confess that I never do redensity 1 injection in the superficial area because I think that redensity 2 do the job not only on the depression, but also on the skin quality. You remember that redensity 2 is a mix of crosslink and non-crosslink HA. And so for that, he is a little bit like a redensity 1 plus HA crosslink inside. So I don't use injection of redensity 1 in this area, but you can do it.
Thank you, Dr. Trevidic. It was very clear. So it was the latest question. We don't have any more questions, so we will conclude for today.
Thank you. Thank you very much. See you soon.
Thank you, everybody, for having attending. We wish you a very nice day. Thank you.
Une autre seringue. Ah, super. Vous n'avez pas eu trop mal?
Dear colleagues, thank you very much for participation of our event. I hope you really enjoy it, and please don't hesitate to come back with your question to us if you still have it. You have my mail, the mail of our contact in your region. You can complete the questions and send to us, and we will be very happy to answer you with all information which you need. Also, we'll be happy to keep the contact with all of you. If you need some additional information about our product, about if you still have a question to rheological conditions, scientific information, etc., please don't hesitate to contact our team. To build the real cool and effective key opinion leaders team, it's one of our strategical points for 2021. And I hope we will continue such type of event during this year. And of course, I hope to see all of you offline in your countries in the global event this year on NBC and on every event of TechSun. See you soon. Have a nice day. And please come back to us with your question. Bye-bye.